Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Part of keeping babies healthy is making sure their diapers are changed when they get dirty, but that can be a financial challenge because diapers are not inexpensive. 3 pediatricians from Upstate have an article about diaper need in the New England Journal of Medicine, and I'm speaking with one of them today. Dr. Winter Berry is an associate professor of pediatrics at Upstate. Welcome back to The Informed Patient, Dr. Berry.
Thanks so much for having me. Good to be back.
Your article in the New England Journal of Medicine is Diaper Need, an Under-Recognized Social Driver of Health. Can you explain how diapers are tied to a baby's health?
Some of the things about diaper need being tied to health are self-explanatory, and some might not be evident to the average listener. If a child is required to stay in a diaper longer than their parent would like to keep them clean, dry, and healthy because of financial constraints, that can lead to things that make perfect sense. So they could get a diaper rash, they could become uncomfortable, they could have poor sleep, etc. And sometimes those even require doctor visits to attend to the diaper rash. There's actually one study, although it's from several years ago and still needs to be repeated, that it does look like some kids have a higher risk of a urinary tract infection from staying in a diaper for longer. So those are the ones that I think come to mind pretty easily. But there's some bigger picture issues when a family isn't able to afford enough diapers to change their child as often as they'd like. So those are things like the parent is more stressed, they have more trouble bonding with the child cries more often, and then even things from an economic standpoint. So if you don't have enough diapers to send your child to daycare, you might not be able to attend school or work yourself. And that can even further the stressors for the family financially, emotionally, and otherwise.
How often do diapers need to be changed on average for like a newborn?
It's actually a big range. The younger the kid, the more often they're likely to go. So it's somewhere in the ballpark of about 12 diapers a day when they're really little. They're smaller diapers and they're a little bit less absorbent because there's less material. When kids are bigger, anywhere around 6 to 8 diapers a day. But unfortunately, the cost per diaper goes up as the diaper itself gets larger. So the cost is pretty static over time. In different markets across the country, the prices vary, but the estimate is about $100 a month or more per diapered child. And that's when you have the luxury to purchase in bulk. And so if families are having to buy smaller amounts at a time or other circumstances, the diaper costs can be up to 5-fold more than what I just quoted.
What percentage of families struggle to afford diapers for their kids in the U.S. or in your clinic's population?
So in the United States, up until about a year ago, the quoted statistic was 1 in 3 families. But the most recent survey done nationally shows it's almost 1 in 2 families, so about 46%. The numbers we've seen in our local clinic population have gone up considerably over the years, and the last recorded information we have is actually higher than the national average. So in our clinic, we're seeing above 60% of families, or around 2/3 of families, that struggle with this issue. That's actually not surprising because Syracuse is known as a metropolitan area that struggles with poverty and struggles with childhood poverty well above national averages. So we would expect that the same families that have financial challenges in other settings would experience that with diapers as well, because there's not much financial support available to those families.
So what about Medicaid or other government aid programs? Can that money be used to pay for diapers?
That's a really common question that's asked, and a common misconception both among parents and also those who aren't aware of the safety net programs. There's not any specific funds set aside for diaper purchase in any of the social safety net programs. So what we like to say is that represents a gap in the fabric of how we support families. There are programs like SNAP and WIC that support food costs. There's housing assistance. There's programs like Medicaid or CHIP that insure children. But this cost, which is relatively high, is left to families to cover. There is a pilot program going on in our local area right now that's also being carried out by the CNY Diaper Bank. And if a family qualifies for something called TANF, which is Temporary Assistance for Needy Families, they do have the opportunity right now to receive more diapers per month to help cover that need and see if it helps those families. Because it's a pilot, we're not sure how long it will last, but there is some funding for that right now. What I'll stress about TANF is that it's pretty hard to qualify in that family's income has to be quite low. And the T stands for temporary. So families are required to make lots of efforts to be able to financially better themselves and are unlikely to stay on that support for a considerable period of time. So again, temporary, but it is a great pilot that those families with the most need are being offered a little bit more support.
Have you seen families trying to use cloth diapers to save money on the disposables?
Yeah, so we have seen families who prefer cloth diapers, and actually the Central New York Diaper Bank, and also if families request it through our office, there are available cloth diaper startup kits, but there are several barriers to the use of cloth diapers. The biggest two pitches used to be that it was cheaper because they were reusable and better for the environment. In recent years, the cost of cloth diaper purchase itself has gone up like the prices of everything else. So the startup cost would be hundreds of dollars at once to get the process started, which families might not have. And then the second environmental issue, as it turns out, there probably isn't that much of a difference in environmental impact between disposable and cloth. That's because the cloth diapers need to be laundered in a way that takes a lot of water and hot water to make sure that they get clean and sanitized. And then the last thing is that many laundromats don't allow for diapers to be laundered in them. And many daycares will not accept a child with cloth diapers. And so if you're sending your kid to one of those daycares or you don't have your own washer and dryer, cloth diapers are no longer an option for your family.
Is there any difference in the number of diapers needed each day for cloth versus disposable?
I would say the need for number of diapers is relatively similar. I think the maintenance and skills required of the caregiver is a little bit higher for a cloth diaper. So there's a learning curve to what size to give, how the inserts work, how to launder, and how soon they can be reused. That requires more skills on the behalf of the caregiver. But the number and absorbency is relatively similar to disposable diapers. I will say in our community, there's relatively few diaper cloth using families, both because of the daycare and cost issues I mentioned, and also because if you chose to use a cloth diaper laundering service, it can be cost prohibitive as well. It used to be commonplace, but now the services are actually quite expensive if you have someone launder them.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Winter Berry, a pediatrician from Upstate's Pediatric and Adolescent Center. When does potty training usually begin?
That is quite a range as well. Sort of like when you asked about how many diapers does a kid need a day. That's very dependent on the kid themselves and in some cases their developmental capabilities. So a typical kid is anywhere from about 2 to 3 years of age. There can be other factors that affect their ability to be potty trained before 3 years of age. But in our office, we talk to families up to age 4 about having diaper need because by that age, a majority of kids have become potty trained. In some other cultures, they choose to potty train earlier and use techniques to help children learn to do so. One thing that is known from the literature, though, is trying to potty train before a kid is developmentally ready to do so can be really stressful for the kid and frankly for the parent. And so it really has to be in conjunction with when the kid is ready and when the family is ready to accommodate that potty training.
Can you tell us about the partnership the Upstate Pediatric and Adolescent Center has with the CNY Diaper Bank?
That partnership is really what makes all of the work we're talking about and publishing about possible. As it turns out, the founder of the Central New York Diaper Bank, Michaela Hugo, was recognizing this issue in the Syracuse area about the same time we started to recognize it in our clinic. And I had a very small operation going independently out of our office at the time, but certainly not to the scale the CNY Diaper Bank was capable. As we started asking clinic families, though, it became clear that we were not going to be able to pull off what families needed with our efforts alone. And so I applied to be a partner agency of the CNY Diaper Bank in 2016, and that's when we started being able to get a sustaining supply And that also meant we could ask every family at their well visit whether they had this need and then be able to provide them with diapers when they got to our clinic for well visits. So we're going on about 9 years of that partnership, being able to support families and also help them to understand we know that there can be considerable challenges being the parent of a young child.
Are the diapers at the diaper bank cheaper than the store-bought diapers would be because they're buying in bulk?
There's a few advantages to the diaper bank as a nonprofit entity doing the purchasing. One of them is that they can purchase in considerable bulk by the truckload, in fact. And so, depending on where we purchase from and even some donations from industry, we can get the cost of the diaper down to about 7 cents per diaper. At a big box store, it would be more like 25 or 30 cents per diaper if you're buying somewhere like a Target or a Costco, et cetera, and can buy in bulk. But for families who don't have a lot of cash on hand, can't order online, or not buying in large quantity, say if you went to the corner store to get some diapers, one of those smaller packages would be around $1 per diaper. So depending on how and where you're purchasing, we can really drive down the cost by purchasing through the nonprofit.
And then, if I understand you correctly, the families, when they come for the pediatric visit, you ask them about their diaper situation and they can collect, what is it, 50 more diapers per child per month?
That number 50 comes from national surveys where families were asked if they had diaper need, what was about the amount they had a gap each month. And that's pretty standard nationally. So that's what most diaper banks do across the country. We've continued the same here. And if, just like you said, if they screen positive for diaper need during the visit, they go home with 2 bundles of 25 diapers in the size they need. And then if they have need in between visits, there's lots of other partner agencies in the community where they can get diapers on a monthly basis. I think we're up to about 50 partner agencies now. They don't all have emergency services, but many do. So if the family's in a bind, there are places they can go to receive similar services.
Can you share the results of the 2023 survey that you did that was, I think, the basis for the New England Journal article? Is that right?
The New England Journal article, we wanted to share our experience of having the diaper bank integrated into our setting because that was relatively unique and certainly one of the first in the country. And then the survey data we used in that paper captured both our clinic population and also the greater Syracuse area. So the CNY Diaper Bank itself asks families to fill out a QR-based survey after they receive the diapers. And that's going to cover families in the city, in the county. We even reach some families outside of Onondaga County. So the statistics there, again, include UPAC families, but also families in the area. And we ask them, once you get diapers, what does that sort of allow you to do? What other benefits are there from receiving these diapers? Some of the biggest outcomes that we saw was that between 70 and 80% of parents reported positive outcomes, that the 50 diapers met the need that they had, that they felt like a better parent, they were less stressed, their child was healthier. And then we were actually able to reach some other struggles for families, things like when this need was covered, they could pay another bill, like a utility bill, keep the lights and the heat on, or they could do things like buy more food for their family. Unfortunately, when families have need like this that isn't met, they're making those tough decisions between enough food, keeping the lights on, paying another bill, or diapering their child. So we were really thrilled to see that that number of families had those much broader benefits than just the diapers in hand.
Do you think the success of this partnership is inspiring other pediatric practices to set up something similar?
I've actually been really thrilled to see how many pediatric settings have similar arrangements. In New York alone, I know that since we began, there have been similar programs developed in the Buffalo area, in the Albany area. I know there's a similar program in Boston, and I've spoke with those folks as well. Independently, there's a program through the Connecticut Hospital Association. There's a children's hospital in Chicago and another program in Stanford doing similar. I think it's really great to see the pediatric community be aware of this and meet this need because it's similar to a lot of other things we address in the office, but I've been really proud of New York. I'm more familiar with the upstate programs, but downstate has some as well. Their response to recognizing and meeting families' needs.
Well, thank you so much for taking time to tell us about this, Dr. Berry.
Absolutely.
My guest has been Dr. Winter Berry, an associate professor of pediatrics at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.